Hello, and welcome to the Office Hours Quality Payment Program QPP conference call. My name is Michelle, and I will be the operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session, and during the question-and-answer session, if you have a question, please press star then 1 on your touch-tone phone. I will now turn the call over to Ms. Candy Hansen. Ma'am, you may begin.
Hi, everybody, and welcome to today's office hours. This is Candy Hansen. I am a program manager with the Lake Superior Quality Innovation Network. And as you know, we serve Minnesota, Michigan, Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization. I want to welcome you to today's session. As Michelle said, today's call is operator assisted. Everybody's phones are muted at this point. She'll open it up later after we go through the didactic. There will be plenty of opportunity to ask questions, and Michelle will provide instructions for that a little bit later. We also have Elena monitoring the chat box as we go through this didactic session. I believe Elena just posted where the slides are found in the chat. She'll be posting them again in a little while. And we just want to know that the information is that we're providing today is based on the latest information that we have from CMS and is subject to change as we learn and interpret things differently. So CMS policies change, as you all know, so we encourage you to review the statutes and regulations that apply to you. So we just said where the slides were. At the end of the office hours, you'll have an opportunity to complete a brief evaluation. We would appreciate your feedback about this event and suggestions for future educational opportunities. We also like to remind those of you that receive direct technical assistance related to QPP to take time to complete evaluations that get sent at each technical assistance encounter. Again, your feedback is valuable and allows us to gauge how we're doing in regards to meeting the needs in a timely and courteous manner. So as we go through and you ask questions, we try to answer the questions as we're able to on the call. However, some questions are take a little bit of research just due to the complexity of the question or how we're interpreting it. So we'll answer what we can, and if we have to take something offline, we'll do that as well. Following the event, we actually kind of outline the questions that were answered, and we get those up and posted to the LSQIN website after the. So with that said, I am going to go ahead and get started, and I just have to, there we go. So here we go. We already talked about the disclaimer. So our objectives for today are just to provide quality payment program updates, and today it's specific to the quality program, summarize some important deadlines, provide an opportunity for questions and answers. Just a few dates that you should be paying attention to. March 2nd, of course, is the day that the 2018 MIPS claims data submission closes. March 22nd, CMS Web Interface data submission closes, and April 2nd, MIPS data submission period for 2018 closes. As you all know, the EIDM Enterprise Identity Management System has now been replaced by HARP, which is it's a Healthcare Quality Information System, Authorization Roles, and Profile System. What we have been told is if you were a previous EIDM account user, you were automatically transitioned to HARP and will use your existing EIDM user ID and password to sign in. If you're a new clinician, you would need to enroll newly with HARP. In the webinars that we have been attending, as CMS said last year, if you haven't had a chance to get in and access your HARP account, please do so as soon as possible. You don't want to wait until the last minute just before the submission deadline just to see if you're going to have any challenges. So you certainly don't have stress on top of everything else that comes along with the quality payment program. All right, so as I said, we're going to talk about the quality category today. And for the 2019 performance period, you can earn up to 45 percentage points. The performance period for the quality category this year is a full year, as it was last year. There are currently 257 MIPS measures for this year. The thing that's the big change for this year in quality is that multiple collection types are allowed for data submission methods except for CMS web interface. And what will happen is that if the same measure is submitted via multiple collection types, the one measure, CMS will score them according to their benchmarks if they have one, and if it's a 7-point cap, and all of those things that it continues to score them, the measures at, and the measure with the greatest number of achievement points will be selected for scoring. So that is new for this year. And as I said, CMS web interface measures cannot be scored with other collection types other than the CMS-approved survey vendor for consumer assessment of healthcare providers, or the CAHPS for MIPS, and or administrative claims. So I'm just going to put out there that you can also, so you could do this on the Quality Payment System portal, on the CMS portal throughout the year, I believe. You also, if you're familiar with the MIPS estimator, you also have a way of going through measure by measure and changing the data submission type, and you'll see right there what your score is, how you're going to fare best if you didn't want to put those multiple measures in the CMS portal. So just putting that out there. So for individual eligible clinicians, as you know, we've got some new language this year. So they can submit measures via multiple collection types, QCM, or which was formerly registry, electronic clinical quality measures, or ECQMs, are the EHR measures, and then the QCDR measures. And something that's new this year is small practices only, those practices that are fewer than 15 clinicians, can submit, are the only ones actually that can use claims to submit their data quality measures. And the other change for this year is that if you are a small practice and are planning on submitting via claims, where you could only always do that as individuals, this year you small practices can submit via claims either as individuals or as a group. And if you are a group or a virtual group, you can submit measures via the registry, the EHR, QCDR, and of course if you're a group of 25 or more, you can submit via CMS web interface. And again, small practices only can submit via claims this year, but they can do so either as individuals or as a group. So the quality category requirements for this year are the same. So there's 6 measures required, including 1 outcome, and if an outcome measure is not available, 1 high priority measure can be selected as your first measure. Specialty measure sets can be used and are available. There's I believe 3 additional specialties that were added for 2019, and I'm just looking for my notes. Sorry about the noise. It was geriatric, skilled nursing facility, and urgent care, I believe, are the new specialty sets for 2019. If you're choosing a specialty measure set and there are fewer than 6 measures available in that measure set, then clinicians must submit all of the measures in that measure set. And then, of course, the all-cause readmission measure remains with a 200-case minimum for the 2019 performance year. So data completeness, and actually this isn't a change, so I apologize for that, but the data completeness requirements are the same. So small practices will continue to receive 3 points on measures that don't meet the data completeness threshold. Large practices that don't meet the data completeness threshold will only be awarded 1 point. So for topped-out measures, the definition and life cycle remains the same for year 3, except that they've added what they're calling extremely topped-out measures, which are measures that are falling within the 98th to the 100th percent or 99.9 percentile. And so those are called extremely topped-out measures, and so they may be fast-forwarded into the removal cycle by virtue of being topped out. And QCDR measures are excluded from the topped out measure life cycle and special scoring policies. So topped out measures, well, we'll talk about those a little bit more in just a minute. So for scoring, again, it's 1 to 10 points per measure. There are 3 to 10 points if the measure meets the data completeness criteria, if the measure has a benchmark, and if the volume of cases is sufficient, which is generally over 20 cases. 7 points, so measures that are topped out in the topped out cycle, in the last year of their cycle before they get removed, get 7 points. And it should be noted on the quality fact sheet, they only list 4 measures that they say achieve that 7-point cap, when in fact we've been, in preparing the 2019 build for the MIPS estimator, we have found that there's, I believe if I got it right in my head, there's like 58 measures that actually can only receive the 7-point cap. So that's another challenge for the 2019 performance year. So these scoring, of course, excludes CMS web interface, which is scored differently. A measure would receive 3 points if the measure meets data completeness criteria, but if it doesn't have a benchmark or the volume of cases is insufficient, then the maximum you would receive would be 3 points. And if you are a large practice, as I said before, and you didn't meet the data completeness criteria, you would receive only 1 point. So bonus points for this year. So there are some changes to bonus points. There continues to be 2 points for additional outcomes and patient experience measures other than the required first one. 2 points for other high priority measures. For CMS web interface this year, high priority bonus points have been discontinued. There are high priority measures. There's a couple of measures related to opioids that have been added as high priority. And outcome measures include intermediate outcome and patient-reported outcome measures. End-to-end CERT still provides bonus points, and bonus points continue to be capped at 10%. It should be noted that if you're going to report via EHR, you have to be using 2015 CERT, and that functionality does not have to be in place until the last day of the performance period, which is December 31st of 2019. Now, I did contact CMS just before this webinar because I was trying to figure out then, because you can't get bonus, so you still would be able to get end-to-end CERT points, but you have to do so via the 2015 CERT without manual manipulation. And so my question was, well, what if I had 2014 CERT for half the year and then 2015 CERT for half of the year? Would I need a data aggregator to get my data out of my 2014 CERT to be able to put into my 2015 CERT to be able to have a full year of data? That would be my thought right now. The person that I was talking to didn't really know at this point. So as we learn more about that, what that means and how that means for EHR, you will we'll let you know as we learn more. And the topped-out measures, just going back to those topped-out measures that score 7 points maximum, 5 of those are EHR, and the majority of the rest of them are both registry and claims measures. So thinking about how you might want to do your data submission for 2019, that will, of course, be impacted by those measures that top out at 7 points. So as far as the quality category improvement score, you'll recall that that's a 10-point additional score based on your improvement in the category score, in the total category score. And of course, higher improvement results in more points. At this point, it's hard to know. There is a specific calculation to tell you what your improvement might have been, which would also then relate to those 1 through 10 points. But I did not include that in here. If you're interested in finding that out, you can just let your states know, and they will try to find that link for you. And in order to qualify for a quality category improvement score, you needed to have participated for a full year in 2018 for the quality category. Small practice bonus. That's changed for 2019. This isn't specifically, well, it is specifically related to quality actually, because this year, in order to receive a small practice bonus, a organization must submit data on at least one quality measure. And now instead of it being 5 points, it's 6 points for 2019. But instead of being added to the final MIP score calculation, it is now added to the quality performance category rather than in the final score calculation. So those 6 bonus points then get added to the numerator of the quality performance category for MIP for organizations that are less than 15 or fewer clinicians. All right. So that's the quality category for the 2019 performance year. Michelle or Elena, have you seen any questions in the chat?
Yes, there is a question from Randy Terry. She asked, can you go over the difference between hospital-based and facility-based? And if you belong to an ACO, we believe that you cannot submit hospital-based when you submit PI. Can you verify that?
So, Randy, you always ask the tough questions on these office hours. I do have some information on hospital-based information. Mona and Elena, you're welcome to chime in here. I'm looking through my notes to find my information on facility-based. I don't have it right at the top of my head.
So, Candy, this is Lisa. Maybe we can do a little searching on that question a little because it is kind of a deeper question. Hospital-based is really how you can report, and a hospital-based clinician, I believe, has 75% or more of their services within the hospital. And Mona, maybe you want to clarify that?
Yeah, and yes, they have to have 75%, but I'm not sure. This would be something we'd have to research a little bit more.
Yeah, I think it's a deeper question.
Yes, I do as well. I do have, in my notes and we will research this, Randy, but the EC is furnishing 75% plus or more of their professional services in inpatient hospital, place of service 21, on campus outpatient 22, or ER 23 claims for a period prior to the performance period. So Randy, we'll take your question out of chat and we'll get back to you on that.
And once we have that, I'll make sure that it's included in the summary of the questions that goes out so everybody can kind of see what we find out. But we'll research that as a team.
Also the part related to the ACO as well, Randy. We'll do that and we'll get that figured out. Elena, anything else in chat?
I know that Lisa it looks like she just wanted to confirm that there are 58 quality measures that are topped out, so they have a maximum of 7 points. But other than that, we don't have any other questions in the chat right now.
Oh, this is Lisa. I should have made the statement to confirm, yes, there are that many measures, and we just took that from the final rule yesterday.
Yep. Thanks, Lisa. So, Michelle, would you remind our participants how they can ask a question over the phone? And again, feel free to put anything into the chat, any questions in the chat as well.
Yes, ma'am. If you have a question at this time, please press star, then 1 on your touch-tone phone. If you need to be removed from the queue, you may press the pound sign or the hash key. And if you're using a speakerphone, you may need to pick up on your handset first before pressing the numbers. Once again, to ask the question, it's star 1 on your touch-tone phone at this time. And ma'am, we are standing by for questions.
We do have a couple new questions in the chat.
Okay.
The first one is, can you repeat the PI and MACRA/MIPS due dates for 2018? So I think you had that slide in the beginning.
Repeat the MACRA/MIPS. Oh, the data submission date? Yes.
Yeah, if you go back, Candy, maybe if you can go back to that slide that had all the kind of reminders, and I have a note to put those into the document that'll go out too. This is Mona.
Sure. Hang on, just about there. So for date, one date that we didn't have on there that we'll want to include for next month is to sign up for being a web interface reporter because that will begin in April as well. So March 2nd is the, if you're doing claims data submission, March 2nd is the date, the last date that claims data submission will be accepted. March 22nd is the CMS, that's when the CMS web interface data submission closes. And April 2nd, and it's not April 2nd until midnight. I can't remember if it's 8 o'clock or 5 o'clock p.m. Eastern time that the MIPS data submission for 2018 closes. Of course, we would suggest that you not wait until April 2nd if you don't have to, just so that you don't stress yourself out. And if, you know, provided you have any technical issues or whatever, you sure wouldn't want to be up to that end of that hour trying to get data submitted. And I believe the CMS web interface to register as CMS web interface, I believe that it is April 30th through June 30th. You guys, do I have those dates right, or I might not have those dates.
This is Mona. That sounds right, but again, I'll look it up and put it in our Q&A document that goes out to the participants.
Yep, and as Lisa said, she and I have been scouring through the final rule related to the quality file. The CMS web interface group of measures has been reduced to 10 measures this year versus I think it was 14 last year. So there have been some measures removed out of the CMS web interface quality measure list as well.
And this is Lisa. Just to add into that, someone had a question on where to find the topped out measures, and you can go to the CMS QPP website, measures, quality measures, and all the files. When you look at the quality benchmark file, it says these are the 2018 quality benchmark files that are topped out. Let me see if I have 2019 measures. I think they're in there also. Yes, they are. So just click on the 2019 year, and they will be, they are in there, the 2019 quality benchmark file. It's a zip file.
Yeah, and just a word about the CMS QPP resource page. It defaults, just so you know that you probably all do, but right now it's defaulting everything to 2018. So as you're looking for something that you think is relevant to 2019, make sure that you've tabbed over to the 2019 year. Otherwise, you'll be looking at older data.
And I just popped that link in for the 2019 benchmarks. Oh, somebody else did too.
This is Mona, and there is a question in the chat about with the new criteria for eligible providers, is there a list of who all would be included in clinical psychologists? And I think we as a group have had that discussion. I don't know, Candy or Lisa, are you aware, or Elena?
No, but if you're, I think always default to going to the NPI lookup tool by individual NPI. It is my advice. They have a list for 2019 that started, I believe, and so just always look there to see if that clinician type is included in the NPI lookup tool. Others?
Well, I would just remind everyone, this is Mona, that the NPI lookup tool now does include the newly eligible clinician types in it and the new eligibility criteria if you tab to 2019 eligibility. Again, as Candy said, for the resource center, the same is true in that lookup tool. It's going to default to 2018 and you'll need to tab over to 2019.
There is another question in the chat that asks, where do I find a list of valid registries?
So again, on the QPPCMS.gov website, if you go to, you'll click on 2019, and then you'll click on MIP, and then you'll click on quality, and then you should see the list of registries. The qualified registries should be listed there. I'm not sure. I guess I haven't looked for the 2019 list. Are those others that are on the phone? Have you? I'll look while we're talking here.
Actually, it's not on the quality tab. It would be on the resources list when you go to the resources in CMS, and we'll link that up there. I'll get to it and put it on the web chat.
Oh, you think it's under the full resource library, Lisa?
Yeah, it's not under quality. I just looked under Explore Measures.
Okay. Yeah, and I just typed in under the full resource libraries where the magnifying glass is. I just typed in qualified registries and tabbed over to 2019. And I see 2018 qualified registries posting, 2019 final rule update for QCDRs and registries. And then 2019 qualified registries, qualified posting. So it's down there. You can find it in there. So. Yep. So it's on the CMS research site. So.
This is Mona, and I did have a question that I thought maybe we'd throw out and have a discussion here since there aren't any coming on the phone. I had a call from somebody who was part of an advanced APM today, and they were for 2017. They were part of an advanced APM. They were wondering how those payments are going to be seen this year. And my understanding of the payments for the advanced APM is that they go to the APM entity. So, for instance, if they receive the 5% incentive, it would go to the APM entity, and there should be some sort of contract, if you are contracted with an APM, that says how you're going to receive those dollars. That's my understanding, but I'd be interested to hear from some of the other people on the line on that.
No, I would agree with you, Mona. That's my understanding as well. Michelle, would you remind our callers once again how to ask a question on the phone?
Yes, ma'am. If you do have a question, please press star 1 on your touchtone phone at this time.
And I don't have my agenda up at the moment. Hopefully someone else does. But do we have a didactic topic for March?
Yes, that should be on 2019 improvement activities.
Okay, great. So for next month's office hours call, didactic will be on the 2019 improvement activities category. And there really haven't been super lot of big changes to that category, we know. I think the most significant change to the improvement activities category is that the PI bonus points have been eliminated. But you'll learn more in the March office hours.
And this is Mona again. I wanted to remind our participants that if you have questions about the QPP program at all on this call, feel free to ask any and all questions, not just stick to that quality category. Although we always have a didactic session, we don't necessarily want that to drive all of your questions. So we're open to any and all questions here.
Yep, thanks Mona for reminding people of that. So the team that's on, any other questions that you can think of that we've received through the QPP portal? I guess, yeah, I can think of one. So one of the organizations that I have been working with, that Lisa and I have been working with this week, is a specialty practice. And so their question, and you all probably are, well, I shouldn't make an assumption, but their question was, first of all, who at their specialties, this was an ambulatory surgery center specialist. It was an ortho specialist, and they provide the services in their ambulatory surgery centers as well as inpatient. And we're wondering, in other places, that, of course, that were not their TIN related. And so first their question was, where all did they have to report to the quality category? And you'll note in the resources that it says that you're ASC-based if you provide 75% or more of your covered services in a ASC or in an inpatient setting. You become ASC-based or inpatient-based. So that being said, what we learned was that this particular organization needs to or is required to submit quality data on all of the settings that they bill Medicare Part D services to. So not just those that meet the definition of ASC-based. What we learned was that ASC-based and inpatient-based definition actually is the qualifier to say whether or not you can reweight your PI category. You were still on the hook to report to NIPS in the other categories. So that was something that we learned. Oh, and then the follow-up to that was, well, you know, how do we get data out of organizations that don't share our electronic health record? And, you know, we recognize that that's an ongoing challenge for specialties because it is challenging, and for inpatient hospital settings, for example, at least in our state, which are largely Epic, if they don't have a way to pull that data, it can be very, very challenging for those specialties to be able to get their numbers for their quality data. So that's not an answer, I guess, but it's just recognizing for specialties that that's a unique challenge that they really have, that you really have if you're a specialty organization. Anything else in chat?
Not right now, nope.
Okay. Well, we'll wait just a couple more minutes to see if anyone has anything else that they have a question about for today. While we're waiting, I just want to thank you all for joining today. As Mona mentioned, we'll compile that and vet the questions posed today, and either email your answers to you or contact you directly, or we will be posting them up on the LSQIN website. If there have been some kind of intense questions today, so we may review those at our next office hours today.
This is Lisa. Just a question to throw out to participants. If anyone who's on the call has already attested on the website and what your experiences have been with that, please share.
Yeah, that's a great. Yeah, go ahead.
I was just going to say there is a question in chat.
Oh, sure.
For 2018 reporting of PI transition measures, do you have to include place of service 21 and 23?
Does anyone on the group happen to know?
This is Lisa. My gut feeling with that is you should, if you have the data, to tell the truth, I don't think CMS has a way to really, audit, if you will, what you've included with your PI category. They can do that with quality a little easier. But PI, there used to be with meaningful use, a 60% of your, documentation has to be included, but they just really have no way of doing that because they're also including other payers like medical assistants, and so going beyond just Medicare paying to including. So it's kind of on your honor to include the data, and if you do get audited, making sure that you at least give an honest attempt to include what you can.
And I would also add.
Yeah, go ahead.
I would go ahead and add, just like with the specialty who was wondering about which settings, that in place of service 21 being inpatient hospital, place of service 22 being outpatient. If in fact you are rendering services that bill Medicare Part D, sorry, not D, I apologize for that, Part B as in boy, that you're on the hook for those settings. That is what I'm thinking. You guys, wouldn't you agree?
That would be.
I think the issue being,
yeah.
The issue being that it's hard to get the data together, collected, unless if you have disparate health, EHR systems, unless you have a data aggregator but also the thing is you don't need a data aggregator for PI information. You can pull your numbers from every system, add them together, and put them in manually.
Yeah, and Lisa, do you want to talk a little bit about what a data aggregator is? Because we've had that question this week.
Well, data aggregation is for quality reporting because that has to be electronic. Like I just said, the PI category, using your EHR, you can pull data from multiple systems and just add your own and enter it in manually, unless you're just using one EHR system that reports for you. A data aggregator, however, will work with you with quality measures that are from different systems, and it's a contractor basically that will put the data together from the different systems electronically, which is required, to be pulled electronically. You can't just enter numbers like you did in Meaningful Use. So that data aggregators are, sometimes they're QCDRs or registries, and it could be an EHR who's also a data aggregator who works with other EHRs to pull their data in. That's how I can explain it best. Does anyone have anything else to add?
No, I think that's right, Lisa.
In the chat, Randy Terry volunteered to talk a little bit about the experiences with reporting this year. I don't know if Randy, if you can get in the queue to maybe talk a little bit about that.
Star 1, Randy, and I'll open your line now. Randy's line is now open. You can speak freely.
Hi, Randy.
Can you hear me?
Yep, we can hear you now, Randy. Thanks.
Yeah, I was on mute. I've probably submitted a couple hundred providers to the system, and it is surprisingly very easy to submit the data. It is not surprisingly, extremely difficult to submit the quality data. We've only been able to get one EHR vendor to be able to upload the data so far. The other ones we've had just nothing but issues. So we've only had one vendor that has been able to upload the quality. We are working daily, hourly with the other vendors to try to get that data uploaded, but have not been successful at uploading the quality. But the PI and the process improvement, the website is extremely easy, very intuitive, very, no issues once you get the proper access.
So, Randy, is the issue with the other vendors that they're unable to produce the necessary file types in order to get it uploaded, or do you know what the issues are?
Well, they're all over the board. They're anywhere from, we get the QRDA 3, or the file to upload, and we get an error. We ask the vendor, well, what's the error? A couple times it's been the wrong 10. A couple times it's been the wrong quality measures. It was the 2017 quality measures, and the vendors hadn't updated to the 2018 yet. That was one. The vendor just hasn't given us the upgrade yet, so we're waiting to get that. That's ECW. Another one, Varian, we're doing the upgrade this weekend to get the 2018. Another one, which is GlowStream, we submitted 2 providers. One worked, one didn't. We worked with the vendor for about 10 different go-arounds, everything from they had the wrong numbers in. It gives you somewhat good data to tell you what it is that's the problem when you upload it and you get an error, but that one took us 10 tries with the vendor to finally get a file that we could upload.
Yeah, and so Randy, I'm really
difficult.
Yeah, I'm really glad you brought up this point because it also speaks to another super important point. If you're relying on a third-party vendor or a registry or a QCDR to submit your data, don't assume that just because they say they're doing it and they said it was done, don't assume that it's correct. Make them give you proof that the file was actually uploaded successfully and accepted. We've all worked with organizations because CMS in the end doesn't really, if your data didn't get submitted, It doesn't matter to them why it didn't get submitted. It's very black and white. The data didn't get submitted. So make sure that you verify that.
Well, you can verify it yourself. You can go right into the website and you can look under quality and you can look to see if it's been updated. And that brings up another point. None of our registries have been able to update the data yet. So we have gotten 0 registries to update the data, and we're working with 2 registries to do that, and neither of them have been able to update the data yet.
What do you mean by update the data?
We've been working with them. When are you going to submit? When are you going to submit? Well, this week, we're having problems. Next week, we're having problems. Maybe by the end of the month, we haven't been able to do that. So they're having just as many problems as the EHR vendors are having.
And I think this is Mona, and I think this really illustrates the reason if you have not logged into the portal to report and poked around in there and made sure that your credentials are working. If you haven't done that already, do that. I would probably suggest that you do it by either today or tomorrow and get that going, because Randy, you're illustrating an issue that you wouldn't want to be working on and scrambling on April 2nd.
Yeah, well, that's
up against the deadline.
This is once I already have all the good credentials. So, it takes months and
that's what I
sometimes
mean.
years to get that.
Right. If there are any people on this call that have not done that step, I would encourage them to do it very soon so that you're not trying to get those credentials and then find out that you have some other issues that you're not going to have time to fix.
And hopefully you're not working with hundreds of different EHR vendors, registries, etc.
Well, hopefully you're not, but there's those oddballs.
Yeah, there are some.
But in Wisconsin, we did have one client that we worked with last year that a vendor submitted their information under the wrong PIN. And CMS, they filed that targeted review, and CMS pretty much just told them, well, that's too bad. It was a mistake, and we can't fix it.
Yeah, that's what I've heard over and over again.
Check your data. Get in there, even if you've hired a third party to do this. Get in there and check to make sure that your score looks like what you would have expected your score to look like.
Yeah, and be cautious of that as well, because last year we submitted data, one of our registries submitted data, and we all had 100% on everything, and we were happy. We got all the screen prints and everything. And then, lo and behold, when we get our final numbers, it's way down, and we said, well, what happened? And they, well, we don't know. Here's what you got. And I said, well, here's a screen print that was submitted, and they said, so sad, so bad, so sad. Didn't give it to us. Even though we had screen prints to show that this is the data that was submitted and these were the scores we had when it closed. So that's another caution to be wary about as far as the quality is concerned. Because they can upload multiple files. Even if they upload one, they could find an error with it and upload another and not even tell you.
Yeah, that's a good point. So.
This is go ahead.
Oh, hi, Mona. So to my earlier point about, I might go ahead and just use the MIPS estimator first to see if you couldn't see how those measures are going to score. I don't know. I don't know exactly how I feel about submitting, the same measure with multiple measures or data submission types, but it is available for us this year.
Mm-hmm.
All right. Anything else in chat? Anybody else have any questions or anything?
There aren't any new questions right now.
All right. Well, thanks everybody for joining us.
Candy,
Candy,
this is Mona, and I just wanted to say, and I don't know if we'll get this year, but last year, all of us from Lake Superior, we did receive a file from CMS. Not necessarily, it was a little suspect, some of it, but they did send us a file that contained errors in submission. So just a reminder, if we do get that file this year and we're trying to reach out to you, about that. If you maybe put that in the back of your head that we might be calling you about that, and if you wouldn't mind taking our call so that we can let you know if you've showed up on an error file.
Yep, good point, Mona.
And I don't know if we're going to get that this year. And last year it wasn't exactly perfect, but we did reach out to some people to let them know they were on there and to check their data.
Yeah, I haven't heard. I don't think we've heard yet if we're going to be getting that file or not. So if we do, we'll certainly let you know.
And we certainly hope that this year is, last year was the first year, and, you know, CMS has been pretty proactive in fixing issues, I think, you know, making things a little easier. So hopefully it's better, but according to the recent statements, we have some work to do yet. Thanks, everyone.
Yeah, thanks, everybody. So when you close out of your webinar, you're going to be getting an evaluation, just a very brief evaluation. So, again, your feedback is appreciated, then we will talk to you next month. Thanks, everybody.
Thank you.
Thank you, ladies and gentlemen. This concludes today's teleconference. Thank you for participating. You may now disconnect.